State officials are conducting panel discussions throughout Minnesota on the recently created Minnesota State Substance Abuse Strategy. A panel today at Bemidji State University included local officials as well as officials from the Leech Lake and White Earth reservations. Lacey Monteleone is live in the studio and has more on the panel's discussion. And Lacey, what can you tell us?
Well, Dennis, the Beltrami County Jail has a population of roughly 100 on any given day. And although those behind bars are there for many different reasons, the Sheriff's Department points out that at the root of many of those crimes lie issues with drugs or alcohol. And officials who took part in today's panel discussion say a better focus on prevention could not only save money, it could help the community as a whole. In Minnesota, health is a top priority.
We're one of the healthiest states in the country, but there are pockets of problems that we have more of.
One of those problems is the growing issue of substance abuse.
We have an unacceptably high level of binge drinking, higher than most other states.
And that's not all. From 2010 to 2011, addiction treatment admissions for heroin rose over 45%. And that's a problem you can see even in Beltrami County.
Heroin is what a lot of the people are turning to because it's a cheaper alternative.
Sheriff Hodap was not the only member of the panel who has seen that problem firsthand.
Lady came in to see our employee there, our intake person, and all of a sudden she started to jerk all over, and pretty soon she was on the floor. Oh, shall I call the ambulance? Oh, no. She was having a heroin withdrawal. That's how prevalent it is. And it's not only adults, it's our kids.
The Minnesota Department of Human Services has a website to show just how prevalent drug use among children in Minnesota can be. While the numbers of students admitting to using heroin in Beltrami County and surrounding areas is still fairly low, prescription drug use seems to be a bit higher. Officials say more culturally appropriate treatment settings could help stop the problem.
They like the culture. That is absent in state systems.
Jessen says it's ideas like this from local officials that will put Minnesota on the road to recovery.
Before, we had different pockets of state government doing different things, and they're all good work. But we think that if we're coordinated, if we're focused on the same goals, if we're working together, we get a lot more bang for our buck.
Now, you heard Jessen say that binge drinking is a problem in Minnesota. To give you an idea of just how big a problem it is, the estimated cost of alcohol use in the state is over $5 billion. That's about 17 times greater than the $296 million collected in tax revenue from the sale of alcohol, Dennis.
All right. Thanks, Lacey, for that report tonight. Live from our studio, the panel will hold another discussion tomorrow morning in Rochester.
If you've enjoyed this segment of Lakeland News, please consider making a tax-deductible contribution to Lakeland Public Television.